Hi, I'm Jackie from Body Sculpting Regina. I'm the nurse injector here. I inject PRP to stimulate hair regrowth.
Okay. So I guess what is the PRP? I guess you say it's for hair growth, but what is it?
PRP is platelet rich plasma. I draw blood from you and we get a concentrated platelets and growth hormone that is injected into the scalp.
Okay. And when you inject it, I guess, what is it doing?
It's stimulating the follicles to grow again.
Oh, just because of the platelets in my blood that you're spitting out there?
Yeah, it's what your body produces already, and it's just the concentrated healthy components that cause that hair to regrow.
Okay. Is it effective?
Yes, half the clients will get almost complete hair regrowth, and the other 50% will get a portion of.
Oh. How many treatments, I guess, do I need for that to happen?
4 treatments in the year, and they're spaced a few months apart.
Okay. I guess, does it work in men only?
No, it's effective for both men and women. It totally can help a woman's self-esteem to have her hair thick and full again. There's more women than we know having that problem of thinning hair or some balding areas, receding areas.
Okay. I guess, how does PRP compare to, if I wanted to go a different route for hair transplantation, how does it compare to it?
Hair transplantation is a surgery. It can scar, and it is more expensive than this procedure.
Okay. I guess but how will it look for my hair if I do PRP compared to if I was to do a transplantation?
Well, it stimulates your own natural hair growth pattern. So the surgery is placed by the surgeon. So you're depending on the skill of the surgeon to have your hair. You get it more instant, but sometimes you need more than one treatment of that also to get a full head of hair. And the PRP causes a natural looking hair growth.
Okay. So yeah, I guess the thing is if I had more questions about this, what should I do?
Yeah, just call the clinic and come on in for a free consultation, and we'll discuss all the factors and if this is right for you.
Okay, well, thank you very much, Jackie.
You're welcome.